It's National Diabetes Week in Australia, so we are doing something a little different on Business Focus this week. We're going to talk about the application of tech to help people live a better quality of life when they are in fact living with diabetes. Ross, our CEO, has done a lot of work with JDRF, which is the Juvenile Diabetes Research Foundation. I had to double check that just to make sure I got it right. And he himself has type 1 diabetes and has done some pretty smart things with tech to improve his own quality of life, and is now looking to help share that message and make sure other people have the same opportunity. Ross, thank you very much for joining me.
Yeah, great to be here.
You are now the highest, the person who has come on the show the most, I think number 3. So congrats, I guess.
Yeah,
cool,
not based on a number of views, just me being here and
also if you say in charge. If you say you want to be on the show, you get to be on the show. That's also it. Okay, let's actually start with your own journey. So your experience with diabetes, how you work with JDRF, and what your intention is for the week that is this week.
Yeah, so I guess like you said, long history. I mean, I was diagnosed diabetic at age 5. The technology was very different back then as it is from now.
I'm just doing the maths.
Yeah.
Yep. Okay.
So 1987.
Okay.
And back then it was, even to test your blood sugar was a big brick machine, and you had to, do a pretty painful, finger prick that from a giant machine that looked pretty bad. So, that was where it started. Obviously, it's come a long way now, and. I've obviously, seen a lot during the time of different technology that's come and going, but probably in the last 5 years, like technology's really in this space has just taken off. Yeah.
Okay. So out of interest, when you were 5, what does finding out that you have diabetes, type 1 diabetes look like? Like what happens to you as a small child for them to go, oh God, something's wrong? Yeah,
I mean, I presented as very, very sick, unwell. Initially, you lose weight, you become quite... very tired, very weak. You go to the bathroom a lot. There's all these kind of symptoms. And the reality is, I don't remember that much. It's more probably traumatic for the parents at that age than the child in a lot of ways. We lived regionally at that point in far north Western Australia. Wasn't a lot of medical help in town, and so it was actually ended up being, making use of a flying doctor service, and then it flew me down to Perth and got me to hospital in time. So
I remember that program on TV in New Zealand when I was growing up.
Yeah, look, they have amazing service, and I said I was one of the ones was the beneficiaries of the work that they do as well. So. So that was winding back a long time, and for those first couple of years, it's your parents essentially administering, all the care, right? And again, when it's very manual back then, it's pretty hard work, I think, compared to how it is now. And drawing insulin out of vials and into syringes and that kind of stuff, it was very different from the experience that I think parents would have now. But that was. As I said, that was the 80s, and it was really a time when even synthetic insulin had only really just come to market. Before then, they used to get insulin out of cows and pigs and give it to humans, right? So it's amazing how much has changed in not even 40 years.
Can you kind of put a clear sort of timeline with the key changes in your own experience? Because we're sort of building up here to talk about how you've used tech to treat yourself, to provide, I guess, care to yourself and to get ahead of issues and to proactively, have all of that happening. So if you can kind of take the key changes, the key progressions, what would they have been?
So, by the time I was a teenager, stuff had progressed. Machines had become smaller for testing, but it was still largely a finger prick and test. The syringe was replaced by the insulin pen that probably a lot of people have seen, but it's still largely it's a needle that you're giving yourself.
It's very invasive.
But it had become more compact and easier to carry and all that kind of stuff, and that was kind of the mid 90s, I guess. And then things kind of stopped for a while. Like nothing much happened. The big change was the move to insulin pumps. It wasn't a path I went down because I didn't like the idea of wearing this giant thing with tubes, and it was it's a fairly active person, and it just never really appealed to me. And so I kind of held off on that technology change, I guess, and I kept using the pen. And it was really only, I said 5 or 6 years ago when the major big change was this move to not have to do finger pricks anymore, right? And to wear a blood glucose monitor, which I'm wearing one today. I mean, that, and there's a couple of major sort of brands out there that make them, but to actually, the first one that was a a little dot I used to wear, and you'd essentially be able to hold your phone up to that, and it would get a reading from it, right?
Okay.
So it wasn't still fully automated, but at least you were wearing it. At any point, you could just tap your phone on there using NFC. It would pass the reading to the phone, and you'd be able to see on your phone your live blood sugar. So that was probably the first big change that happened.
So just to fact check for anyone who doesn't know, NFC is
near field communication. It's basically the same technology used to pay for things on your phone, right?
Gotcha.
So you're basically tapping using your mobile and getting the data from that little device. Now that was a huge change to suddenly not have to test anymore.
Yeah.
And to be able to do that all day, every day, and that was really the first big change. That technology was quite expensive. It slowly became, I wouldn't say more affordable, but the government at some point decided to, through advocacy from groups like JDRF, have decided, it was only a couple of years ago that they extended that pretty much out to everyone that's diabetic. Now you can get that not fully subsidized, mostly subsidized by the government. And so that technology is now available for anyone with type 1 diabetes at a relatively low cost. So that's available, and that's now widespread. It's commercially, in use. There's a couple of different, major manufacturers. But for me, the big change was going to a pump that also was Bluetooth compatible. And a device, a sensor that had Bluetooth, because as soon as you start doing that, you can start connecting them together. And that's really the biggest change, is what I call actually moving to a closed loop system.
And that's what that is?
So I brought this, I'm wearing one today, but it's on my stomach, so I didn't want to show everyone.
Sure.
But essentially, and this is, for me, the big change was moving to a pump that wasn't a big contraption with tubes and everything. And this, it's tiny, really. That's a fully functioning insulin pump, right? Yeah. And so moving to that, I said that it has no controls on it itself, but that connects back to a device via Bluetooth, right?
Okay.
And you can control it. But they're still separate things. Like you've got a device that controls that via Bluetooth, and you've got a sensor here, which said now instead of tapping up with my phone, that talks to my phone via Bluetooth. So you've got these two things that talk via Bluetooth. And there's some very smart people now that, over years have been building, as an open source software project that they've built that can actually start making these things talk. And so that's, for me, was the shift to go, all right, I'm going to use a pump, and I'm going to set up this closed loop system.
Okay.
Where it now becomes a little bit more automated. So,
okay.
It's still very much I said that's not a commercially ready thing, right? Yeah. It's open source software, but for me, in our industry, we've always talked open source software, and we've thought of it almost as a thing that's not as good as paid software. But here's an open source software project that's literally changing.
The benefit is it allows people like you who know what they're doing to take it and make the best of it, right? To continue to innovate without having in a community space where everyone can contribute to get better and faster and lower cost outcomes. Yeah,
that's right. So absolutely, not here to tell everyone to go off and download this software. And in fact, the project is, they've put some really good controls in place themselves. You have to download the source code and compile it yourself. You have to go through a bunch of gates within the software to actually configure and build the closed loop. It takes quite a bit of time to do. But once done, it's now in a situation where live, I've got a system that is every 5 minutes taking a reading and adjusting the amount of insulin I'm getting automatically.
How much, how long would the insulin in that pump last? Like, what was that, a month, a week, a day?
3 days.
Okay.
Yeah. So this is this type of pump is, and even other pumps, they're generally every day. You refill every 3 days. This one's a little bit more different because it's this micro pump sort of thing where you wear as a patch, which means you literally rip it off and put a new one on every 3 days, and send this back for them to recycle and reuse. So. But it's 3 days. And I think that a lot of that is actually not down to the technology of the device. It's actually the life of insulin, because insulin is supposed to be kept in a fridge, right? And so it's actually the lifespan of insulin that I think is the biggest, limiting factor there. But 3 days. Every 3 days, I'm filling up a new one of those with some insulin and putting it on and activating it with my phone, with this software. And then...
I've seen... at a distance. You've kind of shown your phone to me once or twice with all these graphs and these things happening, right? So it's obviously monitoring more than just one metric. It's doing a range of things, and we might, if it's okay, at some point just throw up a screenshot of what that dashboard looks like.
Yeah.
Can you just talk us through, in its entirety, but at a high level, what's it actually doing, and how does it do it?
Look, the main thing it's doing is the primary metric is your blood sugar, right? And it's reacting to changes in blood sugar. The algorithms that are built in, it's changes in blood sugar compared to what the expected change should be based on the insulin it knows it's given. So it's got this concept of the amount of insulin your body should have because it knows it's been dosing that, and looking at the delta of the what's happening to your blood sugar and going, hang on, these things don't match. I need to adjust because food and carbohydrate we eat is the biggest thing, and so I punch in the amount of carbs I eat to give it that information as well.
Okay. So basically like diet tracking almost constantly.
That's right. So, and that's one of the biggest things for diabetes is these micro decisions that talk about. So if I wind the clock back a bit, maybe I'm going on a tangent, but
please.
One of the biggest challenges for diabetics is the number of decisions you have to make in a day. And this is taking some of it away. So let's talk about decision fatigue, right? This idea of you're having to make these, I think they reckon it's about 700 micro decisions in a day around eating. How much do I eat? When do I do this? How much, how much carbohydrates that got? Oh, but it's got fat as well and protein. All those things impact. I've got to do exercise. How that going to impact it?
Well, so my guess is we're all making the same amount of decisions, but you have real world consequences off the back of them. Like we're all choosing whether to eat, not to eat, whatever, but you have to do it with a cloud hanging over your head that what if.
Yeah, and that's right, because you've got downsides to your blood sugar going too high. You've got more immediate downsides to your blood sugar going too low. That's sort of the higher risk in the short term. High blood sugar has your long-term complications. That's where those challenges come on later in life. Mm-hmm. But this is taking those micro decisions away. So I can eat something, and as long as I tell it how many carbs I eat, but it's going to adjust as it goes because it's going to know, hang on, blood sugar's going up a bit more than it should. I'm going to give you a bit extra insulin. So it's always adjusting that algorithm. That's it. But the challenge is that your body is actually, one of the fascinating things about wearing sort of tech like this is, and same as the people that wear your sleep rings, or a ring. Yeah, you would see like, wow, my body does some weird things during the night.
My body's in bad shape.
Yeah, but it's amazing. Like the stress, exercise, sleep. I said that not just the carbs that you're eating, but the other things you might be eating around that. All the different things that that actually impact absorption of insulin and food and stuff. But
it sounds like
bodies are pretty complicated, right? Like
extremely, yeah. I mean, and I'm no doctor, but I believe that to be true. I think the key difference is that with your closed loop solution there, with the insulin, did you say application of insulin? No, the insulin being given to you, being given on the basis of all of this information coming through, biometrics and your dietary intake, etc., is very different than having a ring like this, getting all the metrics and not knowing what to do with it. Like I don't, you know what I mean? Like there's an automated response, almost from like a qualified clinician, almost going, therefore you get this much insulin.
That's right. And so part of setting this up, and it takes a couple of months to do it, is you're building a profile of what your body is like. So what's your insulin to carb ratio? What's your base insulin requirement? What's your carb absorption? How quickly do you digest food? And that can change at different times of the day. So you end up with this profile of your body, which is actually not constant. And different profiles, because if I'm going to exercise, 2 hours before that, I need to tell it so that it's preparing my body to be in the peak position to be able to exercise.
Does that admin grind you down, knowing that you've got to sort of plan out and such?
Look, it's way less admin than it used to be, right? Because historically, traditionally in insulin, you give a base insulin once a day. You can't modify that, right? And so if you know you're going to do something the next day, or you've already had to plan from the day before. If you're doing something, like a lot of exercise is one of the big things. So this is taking some of that away, but it is 100% one of the, I guess, mental health challenges that diabetics have is this idea of just you don't get time off. It's the decisions, it's constant. You don't get to just have a rest for a day.
It's almost overwhelming. It is just constantly.
Yeah,
it constantly needs to be dealt with.
It's like you can manage it, like and some people manage it probably better than others as well, but it can be managed. It's all the time.
Okay, so when we talk about, and particularly in National Diabetes Week, which is this week, that you were talking about improving health outcomes, improving quality of life, and so the key takeaways here for me sound like it's really going. You're not able to get away from it, but you're making decisions less consequential potentially, less planning, less sort of crushing sense of what if.
Yeah, there's that, and and you get a lot of statistics out of running something like this.
Stats,
and I am a data guy. I can vouch for that.
Yeah. Nerd.
Okay. Stats like one of the things that they look at long term now is the amount of time your blood sugar is in range, as in what would a non-diabetic's blood sugar be, and now I'm constantly in the 90-something% range, whereas doing it manually, I'd be good if I was in the 70s. And so later on in life, that's going to massively reduce the chance of complications, right? And so this is why, when the government does go and subsidize tech for this, like, they're not just doing it out of the goodness of their heart, they are doing it because 40, 50 years from now, the payback is a lesser strain on the health system, right? The health economics is a whole other thing again. These are real decisions they're making around not just improving people's lives out of the goodness of their heart, but it's an actual investment to reduce health strain on the system.
True. I mean, we're all laying the base now for our health outcomes later. But it's particularly true when you've got diabetes.
Yeah.
Okay, there's a couple of things I want to touch on. I'm just trying to decide the right order here. JDRF, I might leave a bit of an explanation as to the organization's outcomes and how it came about and your involvement in it. So we'll finish with that. I did want to ask, we've talked a lot about essentially treatment and quality of life improvements. What about a cure? Is there as much hope in that space?
Look, there's a lot of studies, and that's what JDRF is. A lot of the fundraising they do is specifically it's a research foundation, right? It's in research for prevention to start with. So I guess there's two paths there. You've got, can you stop people becoming diabetic? Very different to, can you revert it once it's already happened, right? And so a lot of focus on, is what's the genetic markers and can you prevent all that kind of stuff at the moment. And there's interesting things, but I think there's probably been far greater strides in things like this, like treatment and making it easier.
Yeah.
So no, I don't think there's any
no near-term hope, really.
No, and if anything, I see the technology continuing to get better rather than them being able to prevent diabetes anytime soon. But I'm sure there's a lot of people working on a lot of really interesting things that we don't know about as well. Whether it's at some point, because essentially what you're creating, and this is the software here, they call it Android APS, artificial pancreas system, because that's what they're trying to do. They're trying to replicate the pancreas not doing its job, right? And so that's what they're trying to get to, is this idea of an artificial pancreas that it can adjust to your body in real time, like your pancreas does. It gives you insulin as you need, right?
I've got a great pancreas. No one's questioning my pancreas. So JDRF, juvenile diabetes.
First time pancreas has been mentioned on a technology podcast.
I think so. Certainly in our office as well. I don't think anyone's really been going around flexing on their pancreas, but that's okay. So please, JDRF. Talk to me about its origins and its intent today, and also how you've come to be involved.
Yeah. So look, it's one of the few organizations that exist specifically for type 1 diabetes, research and advocacy. And so, as soon as I was in a position of being able to, do something with the organization, I've definitely wanted to do that. So First Focus over the last few years has, done a few fundraising events, and I think we've got something else that we're underway at the moment.
Okay.
Because what's needed more than anything for an organisation like that is funding, right? Money. So absolutely money, but also wanting to do more and more like this, because advocacy and awareness is obviously huge as well.
Yeah. And do you think that's a big part of it, is that, you are obviously an intelligent guy that can hands-on drive change and improvements in tech that can improve quality of life, but people don't know what they don't know. They don't know that these things are there.
And it's very hidden, right? You don't know someone's got this, you know, but people their understanding of the challenges where it's in a workplace, outside of work, has said that not everyone has the luxury of all the tech that's helping now, and so I said that the more people just can understand what's going on for those people, the better, I think.
Okay, nice. So in the spirit of Diabetes Awareness Week, is there anything you'd like to leave us with in terms of a call to action or anything particularly you'd like to point people towards?
Look, as I said, fundraising is obviously one of the key things. So I know JDRF run plenty of activities through the year, which I encourage people to get involved in. But I'd probably, the other thing I would say is this change often happens through legislative pressure, and to get funding for things. So anytime you can get behind that is always great as well. And I'm sure a lot of people know someone that's diabetic as well, right? So just always being there to offer a hand if needed.
Great. Okay. Well, we'll leave it there. But I think if we can ask, the biggest takeaway today is that if you do know someone living with diabetes and you feel that they're perhaps not aware of the fact that tech can make a change to them, let them know and point them in our direction. If they'd like to know more, Ross would certainly be happy to have a chat. And you can reach out via DM on LinkedIn. And if not Ross, then someone else will be sure to work with you to make that happen. On that front, if there is a subject that you'd like us to cover in a future episode, please reach out directly to me on LinkedIn, Brendan Ritchie, RITCHIE. That often gets mistaken, and let us know. We are trying to create content that adds the most value, and we want to hear from you. Until next time, which will be 2 weeks from now, thank you very much for watching.